Pregnancy, first of all, we must agree that it's a normal phase in life, and a woman's life is to become pregnant. This is not a disease. In fact, I could argue easily that this is the best time in a woman's life when she is in the process of growing a new family inside of her body. She should be in the best health possible. I mean, her body ought to reflect the best health possible. I mean, this is the ultimate purpose, at least as far as genetics are concerned, in terms of the female design, is to produce offspring. So if we agree that it's a normal, natural time in life, we have to next agree that when you get pregnant, you eat the food that's present in the community. Well, people always have. Billions of people, whatever society you lived in, whatever food was available, that's what you ate before you got pregnant, during your pregnancies, and afterwards. You don't go on a special diet. And I want to challenge you for a minute that most babies who've been born on this planet, 99.99% of the babies born on planet Earth were babies that were grown inside of a woman who was nourished by a starch-based diet, like rice in Asia, or corn in Central America and North America, and potatoes in South America. I mean, that's been the fuel that supplied the calories, the fats, the vitamins, the minerals, and oh yes, the protein. Yeah, you may need a little bit more protein when you grow a baby. You need about 2 pounds during the entire 9 months of pregnancy to grow an entire baby. Yeah, that's not much. In fact, it's impossible to not get that 2 pounds. It costs 80,000 calories to grow a baby. Yeah, you need to take in more food. But when you eat more food, you eat more protein and all other nutrients. Unfortunately, when people fail to get the proper kind of advice about diet, what is the best diet for a pregnant woman? Well, it's the diet that 99.99% of people who've ever walked this earth have eaten, and that's a diet based around starches like corn, rice, potatoes, pastas, breads, barley, etc. That's what you're supposed to eat, a minimal amount of rich food at most. Well, what happens if you don't get this advice? You get advice from the dairy and meat industry that the most important nutrients for you, your whole family, especially when you're pregnant, are to eat high protein, high calcium foods. What are you directed to eat? Eat a diet that you'd feed to your cats, or maybe a diet you'd feed to baby mammals. Not a diet you'd feed to a pregnant woman. You end up eating all this meat and dairy, all these calories, all this fat, all this sodium, this lack of fiber, this imbalance of nutrients. It's amazing that a pregnant woman survives. Well, she doesn't survive well because of all the fat and all the calories. She ends up gaining weight. 40, 50, 80 pounds is not unusual for a woman to gain during her 9 months of pregnancy. Well, not only does she gain, but also her baby gains weight inside of her. And so instead of babies being 5, 6 pounds like they're supposed to be to fit out a birth canal that's designed for a 5 or 6 pound baby, you end up growing a 8, 12, 14 pound baby, and they just don't fit. They don't fit through the birth canal. And so what do you have to do? You have to take them out through the top. It's called a cesarean section, which accounts for a large number of births in our society, even more so in other societies. So you end up not being able to deliver your baby as a consequence of overnutrition from the rich Western diet. You end up developing high blood pressure, which results in an ultimate condition called eclampsia, or women get preeclampsia, where they have high blood pressure, protein in your urine, evidence of early kidney disease. Yeah, it's not a good thing to have. And then because of all the fat, because they gain the weight, because the body's trying to survive, it's trying to adapt, they develop gestational diabetes. It's from the Western diet. It's 100% preventable and 100% curable, gestational diabetes. Even if midterm, you decide, look, I'm in big trouble, change your diet. You'll lose that extra weight. You got another 4 or 5 months to go. That could be 30, 40, 50 pounds. Your blood pressure normalizes, your kidneys heal, your diabetes goes away. Hey, by the time it got to be delivered, you could be a tough fighting woman to go in there and perform like you need to do during that time of delivery. So the ideal diet for a pregnant woman has been the diet that most women have consumed throughout all of human history. If you eat the rich Western diet, you just escalate the problems associated with eating rich foods. Why? Because you're hungry. So you eat more of the damaging foods. And it's just not fair for you and your family to have to start out this way. You need to have a good start for you and your baby. I'm Dr. John McDougall.